Hi, I'm Dr. Steve Brada. I'm one of the anesthesiologists here at Aurora Baker Medical Center. I understand you wanted to find out a little bit more about labor epidurals. I was hoping that if we spent some time talking about it right now, that when either I or one of my partners show up to do your procedure, we'll have all of your questions answered, you'll have all the information you need so that we can start addressing your pain almost immediately. A labor epidural is a small plastic tube that's placed through the skin of the back, between the bones of the spine, into what we call the epidural space, which is just outside the sac where the spinal nerves and spinal fluid are. By putting this catheter into that space, it allows us to put local anesthetics and painkillers onto the nerves that are causing your labor pains. We can put them to sleep, effectively alleviating your pain. In order to do that, first thing we're going to do is sit you up on the side of the bed. We'll scrub your back with some antiseptic soap to remove all the bacteria that live on the skin. We're then going to ask you to lean forward and arch your lower back out, kind of like a mad cat. That will effectively open up the bones, the spaces between the bones of the spine, allowing us more room to insert the needle. We'll then numb your skin with a small needle with some local anesthetic. After that, all you should feel is some pressure. We'll place the epidural needle into the epidural space and then thread a small plastic catheter through that needle. The catheter itself is really tiny. In fact, several of them can fit inside the IV that you currently have in your arm. Once the epidural catheter is in place, we take the needle out and tape it up your back. This whole process, depending on the patient, takes anywhere between 5 and 10 minutes to place. It then takes us a few more minutes to get it loaded up to start getting your pain taken care of. What you can expect once the epidural is in is that we can provide a band of numbness from somewhere above your belly button to hopefully down the middle of your thighs. Now everybody responds a little bit differently, so sometimes it may take us a few minutes to get this to get the levels that we want. We might have to lay you down if the level's a little bit too low, or if the level's a little bit too high, we may need to sit you up a little bit. The epidural is designed to take your pain away, but not make you completely numb. Sometimes your legs do get a little heavy or weak, but it doesn't necessarily mean that you're not going to feel your contractions. We just want to take the pain away. Once the epidural is in place, we're not going to be able to have you get out of bed. So your nurse will put a catheter into your bladder to drain the bladder, and you're not going to be able to walk until after the epidural has been turned off. Once we get you comfortable, we're going to hook your catheter up to a small pump that will continue to infuse local anesthetics and painkillers through the course of the labor. So regardless of how quickly or how slowly you deliver, the epidural will stay with you until after you've had your baby. Once you've delivered and we turn the epidural off, it's typically sometime between 45 minutes to an hour and a half before the effects fully wear off. Your nurse will be checking, and once she feels that your legs are strong enough, we'll be able to let you get up out of bed again. Just like any medical procedure, there are some risks involved with placing a labor epidural. The first is, anytime we make a hole in the skin with a needle, we can create a bruise or a sore spot. Your skin is also the body's natural barrier to infection, so by placing a needle through the skin, it does create a spot where an infection could get started. All of the equipment that we use is sterile. It's going to be used once and thrown away, but we will pay particular attention to the site and make sure that we don't have any signs of infection. It's possible to place the epidural into the epidural space, but not get the pain relief we want right away. Sometimes we get pain relief on one side, but not right away on the other. So it may take a few extra minutes to get that to smooth out, or we may have to take the catheter out and replace it to get better results. Loading the epidural can cause your blood pressure to go down by relaxing the blood vessels in your legs. Sometimes, if this happens, we'll need to lay you on your side, give you extra oxygen to breathe. We may need to give you more fluids through the IV, or even some special medicine through the IV to help boost your blood pressure, because your baby's dependent on your blood pressure right now for oxygen supply. If you've had high blood pressure during your pregnancy, this is a particular risk, so we need to know about that before we get started. There are also some people who think that having an epidural can cause you permanent issues with your spine and your spinal cord. This is not true. The place that we're putting the epidural catheter is below the level where your spinal cord actually ends, so there's zero chance we're going to injure the cord itself. The only way that we could have significant nerve problems is if we create some bleeding around the epidural space that goes undiagnosed for a couple of days and creates a blood clot. So it's very important to let us know if you have abnormal bleeding problems, and your nurse will be checking your platelet count, which are the particles in the blood that help prevent bleeding, before we get started. Another potential complication of an epidural is called a spinal headache. If the needle that we put in accidentally goes a little too deep and makes a hole in the sac where the spinal fluid is, some of that spinal fluid can leak out. This can cause you to develop a headache over the next day or two. The headache is usually not present when you're laying down, but when you sit up or stand up, you get a really bad throbbing headache. When you lay down, it goes away, but every time you sit up, it comes back. Now, this is not a dangerous condition, it's just a headache. But if we don't treat it, they can last for a couple days, which can make things pretty miserable when you're taking care of a newborn. I hope that this video has helped explain some of the process of placing an epidural and answered some of your questions. However, when I or one of my partners comes up to start your procedure, we will be able to answer any of the questions you may have. Thank you for your time.